Part A. Extract 1. Questions 1 to 12. You hear a neurologist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. I'm Dr. Wright, the neurologist. Please, tell me what's been troubling you lately.
Good morning, doctor. I've been having these strange sensations, and they seem to be getting worse for the past few months. Well, it's hard to explain, really. It started with just a bit of tingling in my hands and feet, mostly my fingers and toes. But now it's like, sometimes I can't even feel them properly. You know, like they're numb, or there's a prickly feeling, almost like pins and needles. I don't know, it's confusing.
Okay. You said it's gotten worse over the months. How often does it happen? Is it constant, Mihira?
Well, it's not exactly constant, no. It kind of comes and goes, but when it does, it can last for hours. Some days it feels like it's barely there, and then on other days, it just won't stop. I'm not sure if it's linked to something I'm doing or not doing, but it's been affecting me a lot, especially when I try to do things around the house or at work. Sometimes it's like I lose coordination in my hands and I drop things. Just like that, like I've lost control. It's, frustrating.
That must be quite difficult. So, you've noticed coordination issues too. Any weakness in your muscles? Have you had trouble with walking or balance?
Yes, exactly. I've been feeling really off balance. Actually, I've fallen a couple of times recently, which has been embarrassing and painful. It's not like I'm dizzy, it's more like my legs don't always do what I want them to do. It's like my brain isn't sending the right signals to them, you know? Sometimes it feels like they're really heavy, or they just get tired out of nowhere. It's not just my legs, though. My vision has been weird, too. Blurry, sometimes double, especially when I'm tired or if I've been working on my computer for too long. Does that sound, I don't know, normal to you?
Vision problems, you say? That's concerning. And this happens more when you're tired?
Yes, definitely when I'm tired. It's frustrating because I can't predict it. And my fatigue. That's the worst part. Even after a good night's sleep, I wake up exhausted. Like today, I slept for 8 hours and still feel like I've run a marathon. It's really affecting my ability to concentrate and, well, it's making everything harder. My job, my social life, it's like I can't keep up anymore.
So, fatigue and cognitive difficulties as well. How is this impacting you professionally, Mihira?
I work as an accountant, so I have to focus on a lot of details, numbers, spreadsheets, all of that. I don't know, doctor, it's like I'm not myself. I've always been sharp with these things, but lately, I feel like my brain is foggy. I'll forget things, make silly mistakes, and now I just feel confused. It's affecting my productivity, and my boss has started to notice too. It's embarrassing.
That sounds very frustrating. Mihira, have you tried any treatments so far for your symptoms?
Oh, yes. I went to my GP, and she initially thought it might be a vitamin deficiency, so I tried vitamin B12 supplements. I've also tried acupuncture because a friend recommended it, but I don't think it's helped much. I've taken some over-the-counter painkillers when my legs hurt, but nothing seems to be working. And, doctor, I've been reading online which points to multiple sclerosis, and I'm really worried. Could it be something serious like that?
It's understandable to be concerned, Mihira. Based on what you've described, sensory issues, motor dysfunction, fatigue, and cognitive problems, yes, that is something we'll need to consider.
That's why I'm worried. It sounds a lot like what I've been experiencing.
I see. We will need to run some diagnostic tests to confirm. I'll recommend a MRI scan to check for any lesions on your brain or spinal cord. We'll also need to do a spinal tap to analyze your cerebrospinal fluid for specific proteins associated. Additionally, we may order evoked potential tests to measure how your brain responds to stimuli, as this can help detect any abnormal nerve signal transmission.
I understand, doctor. Thank you.
Extract 2. Questions 13 to 24. You hear a cardiologist talking to a parent called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. How can I help you today? What seems to be the problem with your child?
Good morning, doctor. It's my son, Arav. For the past few weeks, he's been complaining of chest pain, especially after meals. I'm really worried, especially because I've read that chest pain can be related to heart problems. He sometimes says it feels like his chest is burning.
I understand your concern, Mihira. This can be alarming, but let's take a thorough look at what might be going on. Can you tell me a little more about what he has been experiencing?
Well, Arav says it's a sharp pain right in the middle of his chest. It gets worse when he lies down or after he eats something heavy or spicy. He's also been complaining of nausea and some difficulty swallowing food. Sometimes he even burps a lot after meals. He says it feels like food is stuck in his throat.
Does he mention any other symptoms like shortness of breath, fatigue, or sweating?
No, but he has been more anxious lately, avoiding meals, and he's not sleeping well because of it. He even asked if it's something to do with his heart, and that's making him more worried.
Have you tried any treatments so far?
Yes, we tried giving him over-the-counter antacids like Gaviscon, which helped a little, but the pain came back. We've also tried cutting out spicy foods, and I've asked him to eat smaller meals. But nothing has made a significant difference.
I'm glad to hear you've tried adjusting his diet and using antacids. Let's go over his history and take it from there.
He's generally been healthy, though he did have a mild asthma diagnosis a few years ago. But nothing serious. In terms of family history, his father has high blood pressure, but no heart issues that we know of.
Thanks for that. It's good to get a complete picture. Based on what you've described, Mihira, it sounds like Arav might be experiencing gastroesophageal reflux disease, which is a more persistent form of acid reflux.
That doesn't sound too serious, does it?
Yes, this is not life-threatening, but it can be very uncomfortable and lead to complications if left untreated. To confirm the diagnosis, I'd like to order a few tests. First, we'll do an upper gastrointestinal endoscopy, which will allow us to look directly at Arav's esophagus and stomach to check for any inflammation or damage. We may also do a pH monitoring test, which measures the acidity in his esophagus over a 24-hour period.
That sounds like a lot of tests. Are they safe?
Absolutely. These are routine, non-invasive procedures. Once we confirm, the treatment will likely focus on controlling the amount of acid in Arav's stomach. The first step would be to prescribe a proton pump inhibitor like lansoprazole. These medications reduce the amount of acid the stomach produces, allowing the esophagus to heal.
How long would he need to take the medication?
He would likely need to take it daily for about 8 weeks initially. After that, we can reassess to see if he can gradually reduce the dosage. Along with this, I'll recommend lifestyle changes, like avoiding large meals, staying upright for at least 2 hours after eating, and avoiding foods that trigger reflux, such as caffeine, chocolate, and spicy foods.
Thank you, doctor. I feel much more reassured now.
You're welcome, Mihira.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a nurse called Mihira talking to a team. Now read the question.
Dr. Paul, I'm concerned about Mr. Harrison's condition. His blood pressure is dropping, and he seems to be becoming increasingly lethargic.
Yes, Mihira, I've noticed those changes as well. His oxygen saturation is also low.
We need to act quickly. Let's prepare to administer intravenous fluids and monitor his vital signs closely. We might need to intubate him if his respiratory status deteriorates.
I'll prepare the necessary equipment and notify the respiratory therapist.
We should also consider the possibility of a pulmonary embolism. Order a CT scan of the chest to rule out that diagnosis.
Okay, Mihira, I'll coordinate the CT scan and inform Mr. Harrison's family about his condition.
Yes, it's important to communicate with the family and keep them updated on his progress. We'll need to provide them with information about his condition and the potential treatment options.
Now look at question 26. You hear a surgeon called Mihira talking to her team. Now read the question.
Team, we have a complex surgical procedure scheduled for Mr. Harrison later today. He's presenting with a large abdominal mass, and we'll be performing a laparoscopic exploration to determine the nature of the mass and plan the appropriate treatment.
What are the potential diagnoses for the mass, Dr. Mihira?
It could be a benign tumor, a cyst, or a more serious condition such as cancer. We'll need to conduct a biopsy to determine the exact nature of the mass.
What are the potential risks and complications associated with the surgery?
As with any surgical procedure, there are risks involved. Bleeding, infection, and complications related to anesthesia are possible. However, we'll take all necessary precautions to minimize these risks.
What are the expected outcomes of the surgery?
The goal of the surgery is to remove the mass and determine its nature. If the mass is benign, we may be able to remove it completely. However, if it's cancerous, further treatment may be required.
Dr. Mihira, will Mr. Harrison need any special preparations before the surgery?
Yes, he'll need to follow preoperative instructions, such as fasting and avoiding certain medications. We'll also need to ensure his vital signs are stable and that he's in good overall health.
Now look at question 27. You hear a pharmacist called Mihira talking to a customer. Now read the question.
Hello, Mrs. Paul. How can I help you today?
Mihira, my child has head lice and I'm not sure what to do.
I understand. Head lice are common among children. They are tiny insects that live on the scalp and feed on blood. While head lice can be irritating and bothersome, they generally do not pose serious health risks. But children with head lice may be teased or bullied by their peers. They do not cause significant physical or emotional harm, and they seem to have nil effect a child's academic performance. However, it is important to treat head lice promptly to prevent them from spreading to others.
How can I get rid of them?
There are several over-the-counter lice treatment products available. You'll need to follow the instructions carefully and treat all family members who may have come into contact with the infected person.
Will these products harm my child?
The products are generally safe for children when used as directed. However, it's important to follow the age-appropriate dosage and avoid applying them to young children.
What about the bed linens and towels? Do we need to wash them?
Yes, it's important to wash all bedding and towels in hot water to kill any lice eggs.
Now look at question 28. You hear an ophthalmic consultant called Mihira talking to a trainee. Now read the question.
Well done on your eye examination, Dr. Paul. Your technique was proficient, and you seemed comfortable interacting with the patient.
Thank you, Dr. Mihira. I'm still learning, and I appreciate your feedback.
I noticed that you were very thorough in your examination. You checked the patient's visual acuity, dilated their pupils, and examined the fundus.
Yes, I wanted to ensure that I didn't miss anything.
That's excellent. However, I did notice that you could have been more specific in your documentation. Be sure to record the exact visual acuity measurements and any abnormalities you observed during the examination.
I'll be more mindful of that in the future, Dr. Mihira.
Overall, you did a great job. Keep practicing your examination techniques and don't hesitate to ask for help if you have any questions.
Now look at question 29. You hear a GP called Mihira talking to a care home manager. Now read the question.
I'm concerned about Mr. Harrison's recent decline in health. He's been experiencing increased fatigue, confusion, and loss of appetite.
That's concerning Dr. Mihira. Have you noticed any other changes in his behavior or symptoms?
Yes, he seems to be withdrawn, isolating himself from others, and expressing feelings of sadness and hopelessness. He's also lost interest in activities he used to enjoy.
Those are all signs of depression. It's important to address this promptly to prevent it from worsening.
I've tried to encourage him to engage in activities and spend time with loved ones, but his symptoms persist.
Dr. Mihira, we should consider a referral to a mental health professional for a more in-depth evaluation and treatment. They can provide appropriate counseling and support.
That's a good idea. I'll schedule an appointment with a therapist and discuss the situation with Mr. Harrison.
Now look at question 30. You hear a physiotherapist called Mihira talking to a carer. Now read the question.
Mr. Paul, I'm pleased to see Mr. Harrison's progress. His range of motion has improved significantly.
Thank you, Mihira. We've been working hard on his exercises at home.
I'm impressed with his dedication. Let's continue with the exercises we've been doing and incorporate some new ones to challenge his muscles.
Great. He's ready to push himself.
Remember to listen to your body and avoid overexerting yourself. It's important to balance exercise with rest.
I'll be careful. I don't want to set him back.
That's important. We'll gradually increase the intensity of the exercises as he improves. Are you experiencing any pain or discomfort during the exercises?
A little soreness, but it's manageable, Mihira.
That's normal. As his muscles get stronger, the soreness should subside. If the pain becomes severe or persistent, let me know.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a sleep therapist, Dr. Mihira, and an interviewer.
Good morning, everyone. Today, I'm excited to share an initiative that has the potential to change the very fabric of healthcare as we know it, our launch of sleep therapy at Mihira Healthcare Institute, through our unique care platform, Mihira Care. This isn't just about introducing a new program, it's about pioneering a vital shift in how we view and treat one of the most neglected aspects of human health, sleep. At Mihira Healthcare Institute, we have always sought to innovate, focusing on holistic health. This sleep therapy initiative is an extension of that vision. Through Mihira Care, we're launching a comprehensive program that focuses on diagnosing and treating sleep disorders such as insomnia, sleep apnea, and restless leg syndrome, among others. Our initiative goes beyond the simple treatment of symptoms. We aim to understand the underlying causes of sleep issues, taking a multidisciplinary approach that involves neurologists, pulmonologists, psychologists, and nutritionists. What makes this project special is its patient-centered design. We are moving towards personalized healthcare by incorporating sleep into the wider context of an individual's physical, mental, and emotional well-being. Mihira Care emphasizes long-term solutions rather than quick fixes, with ongoing support, education, and monitoring to ensure lasting changes. The ripple effects of introducing sleep therapy into the mainstream healthcare system are enormous. Currently, many of our patients and healthcare professionals do not fully understand the deep interconnection between sleep and overall health. Poor sleep is directly linked to chronic conditions like diabetes, cardiovascular diseases, and mental health disorders, yet it is often overlooked or treated as a secondary concern. With Mihira Care, we expect to see a significant reduction in the number of patients suffering from such chronic conditions. The preventive aspect of sleep therapy will relieve pressure on the healthcare system by reducing the need for repeated hospital visits or medication for issues that could have been resolved through better sleep management. On a broader level, sleep therapy can potentially revolutionize the way we think about preventive care. Rather than waiting for patients to develop chronic issues, we can intervene early by improving their sleep quality. This proactive approach will not only lower healthcare costs, but also improve patient outcomes across the board. Launching this initiative has required a carefully considered strategy, balancing patient needs, scientific research, and practical implementation. At Mihira Care, we've developed a multi-step strategy to ensure this program delivers its full potential. The first step involves a thorough diagnostic phase, using both subjective sleep assessments and objective measures like polysomnography and wearable sleep trackers. This allows us to pinpoint the exact nature of a patient's sleep disorder, but the approach doesn't stop there. Once diagnosed, we employ a combination of cognitive behavioral therapy for insomnia, CBTI, medication where necessary, and lifestyle interventions, such as sleep hygiene education and nutritional adjustments. But our strategy goes even deeper. We understand that sleep is not just a medical issue, but also a social one. That's why we're integrating sleep therapy into Mihira Care's larger ecosystem, which includes mental health services, chronic disease management, and even corporate wellness programs. This interconnected approach ensures that every part of a patient's life is addressed in treatment. Collaboration across departments ensures that patients aren't siloed into one form of care, but benefit from a truly integrated approach to their health. While we're still in the early stages of the program, there are several indicators that Mihira Care's sleep therapy initiative will be highly successful. Preliminary data from our pilot trials are already showing a marked improvement in patients' sleep patterns, with many experiencing reduced symptoms of insomnia and an overall increase in the quality of their sleep. We are also seeing improvements in secondary health outcomes. Patients who had previously suffered from chronic fatigue, anxiety, and even hypertension are reporting better results after focusing on sleep. This suggests that the benefits of sleep therapy will extend far beyond simply getting a good night's rest. Given the widespread and deeply interconnected nature of sleep disorders with other health conditions, we are confident that Mihira Care's initiative will set a new standard in patient care, eventually becoming a key part of mainstream healthcare both locally and nationally. Patient feedback has been overwhelmingly positive so far. What's been particularly interesting is that many patients were initially skeptical about the idea of sleep therapy. After all, sleep is something we all do naturally, right? But once they began working with our team and experiencing firsthand how their sleep quality impacts their overall health, their views changed. Through Mihira Care's structured sleep programs, patients are not only sleeping better, but are reporting improvements in their energy levels, mood, and productivity. Some have even reduced their reliance on medications for conditions like anxiety and high blood pressure. This holistic improvement is a key driver of patient satisfaction. The long-term engagement strategies we've put in place, including follow-up consultations and sleep monitoring, have also ensured that patients feel supported throughout their treatment journey. Of course, no initiative of this scale comes without challenges. One of the main issues we've encountered during our pilot phase is the difficulty in maintaining patient compliance, especially with lifestyle changes like limiting caffeine or sticking to strict sleep schedules. While many patients initially see the value in these adjustments, long-term adherence has proven to be a challenge. Additionally, we've had to refine our treatment protocols. For instance, we found that some patients required more intensive psychological support than initially anticipated. We've now integrated additional counseling and mental health resources into our sleep programs to address this gap. Looking ahead, we're focusing on refining our engagement strategies to keep patients motivated and on track. We are also planning to broaden our reach by offering virtual sleep therapy consultations, which will help us serve a wider range of patients, particularly those in remote areas.
Now look at Extract 2. Questions 37 to 42. You hear a social worker, Mihira, and an interviewer talking about hospital-acquired depression. You now have 90 seconds to read questions 37 to 42. Good afternoon, Mihira. Thank you for joining us today to discuss a growing concern in healthcare, hospital-acquired depression. This is something that has been receiving more attention lately. Could you start by telling us what led to this recent focus on studying hospital-acquired depression?
Thank you for having me. This is indeed a very pressing issue. Hospital-acquired depression, which refers to depression that develops during or after a hospital stay, has seen an increase in recognition in the last decade. It wasn't always seen as an immediate problem. Initially, mental health wasn't the primary focus when patients were admitted to hospitals for physical conditions. However, over the years, healthcare professionals started noticing certain patterns. Patients who entered the hospital for physical treatment, often for long-term conditions or serious injuries, began showing signs of depression, even if they had no prior history of it. This triggered the need for a more formal study. The conversation really picked up momentum when post-operative outcomes were linked to mental health. Patients who showed depressive symptoms during recovery seemed to have longer hospital stays, reduced healing capacity, and a higher likelihood of returning to the hospital. That realization prompted healthcare providers and researchers to look deeper into the psychological impact of hospitalization.
It's fascinating how something that initially seemed secondary has emerged as such a key concern. Mihira, after conducting this study, what did you find about the prevalence of hospital-acquired depression?
The findings were startling in their clarity. We found that up to 30% of patients who had been hospitalized for more than a week showed some form of depressive symptoms by the time they were discharged. Among patients with chronic illnesses, this number was even higher, hovering around 50%. Interestingly, depression wasn't always identified by overt sadness or emotional withdrawal. Many patients exhibited what we call masked depression, where the symptoms manifest as fatigue, irritability, or a lack of interest in participating in recovery efforts. Often, these signs are overlooked, especially when healthcare providers are focused on managing the primary physical illness. Another key finding was that age and prior mental health history weren't the only determining factors. Even patients without any known history of mental health issues were showing signs of depression simply due to the hospital environment.
That's quite a significant percentage. With so many people being affected, Mihira, what do you think could be the reason behind the rise in hospital-acquired depression?
The increase can't be attributed to a single cause, but rather a combination of several factors. One major contributor is the isolation that often accompanies hospitalization. When someone is taken out of their home environment and placed in a clinical setting, it can lead to feelings of disconnection from their usual social support networks. Hospitals, by design, are sterile and controlled environments, which, while necessary for physical recovery, can sometimes feel dehumanizing for patients. Another contributing factor is the fear and anxiety that accompany hospitalization. Patients are often surrounded by uncertainty about their health, the possibility of prolonged treatment, and, in some cases, the realization of their own mortality. The hospital becomes a place of vulnerability where their sense of control is significantly reduced. Additionally, the sensory deprivation many patients experience, limited sunlight, lack of varied stimuli, and monotonous routines, plays a large role. These factors, combined with pain management regimens, which often involve medication that can exacerbate mood changes, create an environment ripe for depression to set in.
That paints a very layered picture of the issue. Given the complexity of causes, Mihira, what do you think about possible resolutions or ways we can reduce the impact of hospital-acquired depression?
This is definitely where things become more challenging. You see, the resolution isn't simply about prescribing antidepressants or offering post-discharge counseling, though both are important elements. What we need to do is rethink how hospitals themselves function. For instance, creating a more emotionally supportive environment within hospitals could go a long way. Simple adjustments, like ensuring patients have more access to natural light, encouraging social interaction, or incorporating greenery and nature-inspired designs, have shown to positively affect mood. At the same time, integrating mental health screenings into regular hospital protocols is critical. If healthcare providers make it routine to assess patients' mental health alongside their physical recovery, we can catch depressive symptoms early. Furthermore, interdisciplinary collaboration between physical and mental healthcare professionals is key. When a team treating a patient with, say, heart disease also involves a psychologist or psychiatrist, the chances of recognizing early signs of depression are much higher. But we also have to be cautious. Not all depressive symptoms require medication. Sometimes, the best interventions are holistic, involving cognitive behavioral therapy, mindfulness techniques, or even just conversations that validate the patient's feelings.
That makes sense. Early intervention seems crucial. How can hospital staff and the healthcare system address this on a practical level, Mihira?
There are several ways this can be addressed practically. First and foremost, education and training are key. Healthcare workers need to be trained to recognize not just the physical signs of illness, but the psychological ones as well. A nurse or doctor's ability to detect early signs of depression can make a world of difference in terms of timely intervention. Hospitals should also incorporate mental health specialists into their standard care teams, especially for departments dealing with chronic conditions like oncology or cardiology. In addition, regular check-ins with patients about their emotional well-being, not just their pain or physical discomfort, can be standard practice. And then there's the post-discharge phase. Following up with patients once they leave the hospital, particularly those who show signs of depression, should be a priority. Creating continuity in care and ensuring that these patients are connected to community mental health services can help in preventing long-term depression.
Lastly, Mihira, what role do you think family and healthcare workers play in mitigating the effects of hospital-acquired depression?
Family and healthcare workers play an absolutely pivotal role. Families, for example, are often the closest support systems for patients. Even though hospitals can feel isolating, family visits provide comfort, familiarity, and a connection to the world outside. Encouraging families to stay involved in the patient's care, whether through visits or remote communication, can help the patient feel less alone. Healthcare workers, on the other hand, need to bridge the gap between clinical efficiency and empathetic care. Sometimes, small acts of kindness, taking an extra moment to explain a procedure, acknowledging a patient's fears, or even just engaging in non-medical conversation, can greatly alleviate the emotional burden of hospitalization. These interactions humanize the experience for patients and can play a significant role in preventing depression. Ultimately, both groups are part of the larger support system that patients need to navigate the emotional toll of their hospital stay.
That is the end of your OET listening test. Now check the answers.